Dear students, in this lecture, we are discussing about bacterial diseases in man. We will be discussing about 4 bacterial diseases: diphtheria, pneumonia, leprosy, and ornithosis. First, let us see about diphtheria. Diphtheria is a disease caused by Corynebacterium diphtheriae. The causative organism of diphtheria is Corynebacterium diphtheriae, and this bacterium causes sore throat with a thick covering in the back of the throat, tonsillitis, and it also causes blood infection which is called bacteremia, and it also infects the heart which is called endocarditis. It is a fatal disease which can lead to the death of the infected person. And how it is spread? The diphtheria bacterium is spread through the respiratory droplets due to sneezing and coughing. Or if we are talking to a person who is infected with Corynebacterium diphtheriae, the respiratory droplets can enter into the respiratory tract of the healthy person, or if he is coming in direct touch with the infected person, then also the bacterium can get transmitted. The disease diphtheria, it is a fatal disease, but immunization or vaccination is available for safeguarding children against the infection of this bacterium. The process of vaccine development involves growing the Corynebacterium diphtheriae under laboratory conditions and harvesting the toxin. The toxin is then injected into the body of an animal like horse, and the immune response of the horse will develop antitoxin against this diphtheria toxin. The antitoxin is then collected and separated from the serum of the animal, and it is then purified and made available as vaccine for use by human beings. Next, let us see about pneumonia. Pneumonia is an infection that causes inflammation of the air sacs or alveoli in the lungs. When a person is developing pneumonia, the air sacs or the alveoli in the lungs will get filled with fluid or pus, and it can cause cough with phlegm or pus. Then it can also result in developing fever, chills, and difficulty in breathing. Etiology of pneumonia. Pneumonia is caused by viral infections, bacterial infections, or fungal infections, and it can also be caused by other causes like aspiration. When some object is getting into the respiratory tract, it will cause an irritation, and the mucus cells in the respiratory tract will produce more mucus, and this can result in the accumulation of fluid in the alveoli, and it can also cause pneumonia. But the most common cause of pneumonia is the bacterial infection, and the bacteria which causes pneumonia is Streptococcus pneumoniae. These are the symptoms of pneumonia. It infects almost all the organs of the body. It causes a general systemic infection which causes high fever and chills. Then it causes clamminess of skin, which refers to wet or sweaty skin. Then blueness of skin will also develop. Then when pneumonia infects the lung, the person will develop cough with sputum or phlegm. Then the infected person will experience a shortness of breath, then pleuritic chest pain, and hemoptysis. Hemoptysis is the coughing of blood originating from the respiratory tract. Then the person will experience muscular fatigue and aches. Then it can affect the central nervous system of the person, causing development of headache, loss of appetite, mood swings. Then blood pressure will go down. Then there will be an increased heart rate. Then pneumonia can infect the gastrointestinal tract, causing nausea and vomiting. Then it can also affect the joints, causing the development of pain. Next, let us see about leprosy. Leprosy is also known as Hansen's disease. It is an infectious disease caused by the bacterium Mycobacterium leprae. This disease affects mainly the skin, the peripheral nerves, mucosal surfaces of the upper respiratory tract, and the eyes. These are the symptoms of leprosy. Usually, the persons who are infected with Mycobacterium leprae will develop discolored patches of skin, and these patches will look faded when compared to the surrounding skin. And in these patches, the person will not have any sensation, so he will be experiencing numbness. Growths or nodules on the skin will also appear. Then the skin can become thick, stiff or dry. Painless ulcers can appear on the soles of the feet. Painless swellings or lumps on the face or earlobes will develop. Loss of eyebrows or eyelashes can also develop. The last bacterial disease that we have to discuss is ornithosis or psittacosis. It is a zoonotic infectious disease which is caused by the bacterium Chlamydia psittaci. It is transmitted from infected birds, that is pet birds. So it is a zoonotic infectious disease. This is the slide showing the transmission of psittacosis. Droppings of the infected birds will be having the bacterial spores, and if a person happens to inhale the dried bird droppings, or if he is handling the feathers or tissues of infected birds, and if he is having mouth to beak contact, all these can result in the transmission of psittacosis. The bacterial spores are inhaled into the lungs, and in the alveoli these bacterial spores are lodged, and there they replicate, and they are then transmitted to the brain or the central nervous system, and they cause various disease conditions. These are the symptoms of psittacosis or ornithosis: fever, chills, headache, malaise, that is general discomfort, muscle aches, dry cough, and shortness of breath. All these symptoms can begin within 5 to 14 days after exposure to the pathogenic microorganisms. Sometimes these disease conditions can become fatal, resulting in the death of the infected person. So that is about the bacterial diseases infecting man. Thank you.